Welcome back. To complete our discussion talking about breast cancer, joining me once again, Dr. Eric Wallace, Associate Professor, Internal Medicine at the University of Oklahoma School of Community Medicine and OU Physicians. Let's jump in. Now, I want to follow up with a few things that you said. One is looking at the breast cancer screenings. Let's say the woman does go to every couple of years, and you talked about comparing that against the baseline at each point in time. How fast of a cancer is this in terms of its growth process? So if you're going by these recommendations and you're going every couple of years or something like that, is this a fast-growing cancer where you might be out of luck when you go back? Is it very slow? What?
Another tough question to answer because there's still so much we don't know about breast cancers. But one of the recommendations that's new compared to old was that once you get to age 50, instead of doing yearly mammograms, that you should do every other year mammograms, or what they call biennial. So every 2 years instead of every 1 year. And that was based on the data showing that by doing it every year versus every 2 years, you're not really losing a whole lot of benefit in terms of reduction of deaths from breast cancer, but you are reducing quite a bit the number of those false positives and the number of harms that you can achieve by doing yearly mammograms. So that's the reason they spaced it out from 1 year to 2 years, is that you still achieve pretty much the same benefit, but much fewer harms and risk associated with mammograms.
So that's good to know. So it must be relatively slow growing where you don't come back and all of a sudden it's out of control in 2 years.
But you're still going to hear individual people and individual cases where, you know, within the course of a year, this breast cancer developed. And it may have not been seen on the previous mammogram. It may have been obstructed by something else. And some breast cancers that grow are never seen on mammogram. That's another thing to keep in mind as well.
And I do want to ask you in relation to that, before I get to another question on insurance, looking at that, other types of screenings. We're talking about mammograms, but are the manual manipulations that women can still do in terms of breast exams, are those still recommended and have value?
Actually, they are no longer recommended, and this is really interesting because you're going to find tons of women out there who say, I found my breast cancer because I examined myself, found a lump, went to my doctor, and they diagnosed it as breast cancer. The problem is that if you do self-breast exams, by the time you've palpated a lump, if you look at all women in general, by the time you can feel it, it's already grown to a certain size that it may have spread. It may have spread to the lymph nodes in your arm. It may have spread to other sites in your body. So although you may feel a lump, it may be too late to lead to a cure and a longer life. Now, should women not examine themselves? No, they actually should examine themselves, but the recommendation states that I should not be teaching you to do a routine exam on a monthly basis to check for a lump in your breast. But if you do find a lump in your breast by doing a self-exam at any various time interval, then yes, you should tell your doctor because that could be a breast cancer. And that's a little bit confusing for people to understand.
That is very confusing.
Another way to equate it is, let's say there's a leg cancer, just to be in general. Now, if you find a lump on your leg, well, you should go tell your doctor about it because it could be a cancer. But there would be no evidence showing that me telling you to examine your leg every month in this way to look for a lump, that's going to reduce your risk of death from that leg cancer. But if you find it, you should let someone know.
So still, if we're doing monthly self-exams, but in combination with the yearly or every couple of years breast exam and talking with your physician about that in terms of mammography type of exam, then that's still okay, but the monthly is not necessarily needed because if you're doing the routine, whichever the routine becomes, it may detect that at the same point in time, but you can do it because it doesn't hurt anything.
Well, there's also
you know what
I know, and again, we could go on for hours talking
about
this.
But that becomes kind of the gist of it. So you're not saying stop doing your monthly exams. Continue to do that, but don't see that as the only thing.
Correct. Correct. And actually, the American Cancer Society no longer recommends the self-breast exam on a monthly basis either, because it hasn't been shown to lead to any long-term benefit in the population of women. So on an individual basis, if you want to examine your breast, great. If you find something abnormal, please let your doctor know. And even the clinical breast exam, there's not any evidence showing that doing a clinical breast exam, so going to see your doctor on a yearly basis to do a breast exam, leads to an improvement in deaths due to breast cancer. But at this time, do we still recommend doing it? Yes, until more evidence comes out.
Okay, so is the main screening methodology that tends to be about the most reliable still the mammogram?
Yes, the mammogram has been shown to reduce deaths from breast cancer because it's able to catch it at an earlier stage.
Okay, now let me ask this question in terms of insurance, because those that have insurance, that are fortunate enough to have that, with some of these recommendations changing, is that going to change how insurance companies are willing to pay for this service? Where are they going to go by the recommendation of every 2 years from this one group, or you don't, I mean, and therefore if we want it more frequently every year, we've got to come out of our pocket with those money? I mean, how is that going to work?
Right, and this is a big concern among people. A couple facts to understand about these recommendations is when the task force came out with these recommendations, it's purely based on unbiased scientific evidence. There was never any cost consideration taken into account with these recommendations.
Okay.
So, but a lot of people have taken this and run with it to say, oh, this is rationing, you know, insurance companies won't pay for this anymore, have spread a lot of fear, which is totally unfounded at this point. Insurance companies have said that they're not going to cut back on doing mammograms.
Okay.
Every organization I know has still recommended and will still approve paying for those mammograms at this time.
Okay.
And until there is broad consensus about cutting back on the number of tests we do, I don't see insurance companies or government agencies who provide healthcare insurance, I don't see them as cutting back or scaling back from the current recommendations of doing yearly or every other year mammograms. Okay. Essentially, if you're a woman and you've decided that you want to get a mammogram based on the recommendations that are out there, then you should still be able to get those mammograms done.
Okay. Now, are there, in our last couple seconds together here, and I do want to tell people if they hear a little bit of extra noise in our background, we do have some construction going on right outside of the studio. I'm not sure if the mics are going to pick that up or not.
Okay.
But let me ask you this question. Are there certain women, in terms of racial classifications, that are more predisposed than others? We talked about other risk factors in terms of genetic and those types of things, but are there any incidences where there's more breast cancer in one racial group compared to another?
Absolutely, and this is one of the flaws of the recommendations, where a lot of the studies that have been done out there mainly focus on white women. And it's well known in society that there's a tremendous racial disparity in terms of the rate of breast cancer occurrence, the deaths from breast cancer among minority populations, especially African Americans and Hispanics. Part of it may have to do with genetics, but a big chunk of that is lack of access to health care. Okay. About a third of the women out there right now aren't getting regular screening mammograms. So one of the travesties in all this is that we know mammograms are great, we know they reduce risk from breast cancer deaths. However, there are women who are not getting their mammograms done, and it's women who are of minority status, it's women who don't have health care insurance that are most vulnerable to this and are still vulnerable from dying from breast cancer.
And so if people don't, especially those in those racial classifications, don't have health care, or anyone does not have health care coverage, they should be able to maybe call OU physicians here. We're going to put up the number here and put how they can contact you, or talk to their healthcare provider if they're seeing other people. If they don't have one, call a healthcare provider is what I really mean, to say, can you point me to areas where I might be able to get a mammogram screening? I don't have coverage, I can't afford it.
Right, and there are resources out there to get mammograms if you're not able to afford one, and there are multiple organizations that do that. So the best thing to do is to talk to someone you know, talk with a healthcare provider, and they can start to point you in the right direction about how to find those resources to get your mammograms done.
Yes, and that's important. So I want to emphasize again, if they don't have a healthcare provider, can't afford it, call one and say, I can't afford this, but I do need to access care. Can you help me and direct me where I need to go? And of course, OU Physicians and OU School of Community Medicine is a good resource to get that question answered.
Yes, it is.
Thank you so much for joining me, Doctor.
Well, thank you.
And helping the confusion. Okay.
I hope I cleared things up.
You did.
Okay.
Thank you. Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And don't forget to also visit me on YouTube at youtube.com/Health Alert USA. Take care, and remember, talk to your healthcare provider. If you don't have one, give Dr. Wallace a call, get the information, look at those screenings, and I have to say, personally, I'm still doing my every year screening. Take care. This program would not be possible without the support of OU Physicians in Tulsa.